The COVID-19 pandemic has further highlighted harsh health disparities experienced by American Indian and Alaska Native populations.
We recognize, and the research has shown us, that the impacts of racism impact the overall health outcomes of racial and ethnic minorities.
Data from the Centers for Disease Control and Prevention shows that this population has had the highest death and hospitalization rates from the virus. But tribal communities have been quick to vaccinate their populations, and that, along with other evidence-backed strategies, has been instrumental in changing the trajectory for a group that has suffered from the virus. Navajo Nation, for example, has gone from having the highest per capita COVID-19 infection rate in the country last year to having no new cases or deaths on March 22nd of this year. In late March, officials said the tribe's immediate goal was to get 80% of the adult population vaccinated by the end of April. Vaccine acceptance rates are high among many tribal populations. Data shared during a Senate Health, Education, Labor, and Pensions Committee hearing recently showed that 75% of Native people are willing and want to take a COVID-19 vaccine.
Their main reason for doing that is they saw themselves as an individual who had a responsibility to their community.
Experts also say that tribal communities had high vaccination rates even before the pandemic, and that has contributed to the uptake of the vaccine. Overall, the prevalence of crowded intergenerational housing, understaffed hospitals, and higher rates of lower respiratory disease among American Indians has been a big driver of the disparities. The federal government, for its part, has poured additional resources into addressing these disparities during the pandemic. The recent COVID-19 relief law appropriated $6 billion for IHS, with $600 million pegged just for vaccine distribution.
Overall, we're committed to reducing health disparities and ensuring equity in our response to COVID-19.
But remember, widespread vaccination isn't the only strategy responsible for fewer cases of COVID. Experts have emphasized using a multifaceted plan, including mask mandates and broad testing. And some tribes continue to have very strict restrictions in place, such as curfews, long after most states have begun easing restrictions. The situation continues to change, but many tribes have expressed more hope as vaccines continue to be distributed.